So yeah, all right, guys. I started us a little bit late, so I'm gonna get us rolling here. Um, and thanks to Michael for helping me not have to multitask and do let people in because everyone, I think probably a lot of people here know I'm terrible at that. But it's wonderful to see everybody. Thanks so much for coming out. We have a lot of stuff to talk about today, so I'm not going to take up a lot of time, but a few housekeeping pieces. My name is Julie. I work on the organizing team alongside, excuse me, Michael and Christy at IMALS. We're thrilled to have you here. And just a note that this panel session was created, sorry, everybody, and brought to you by the Legislative Affairs team at IMALS. I'm going to put a link in the chat if you want to learn more about the incredible work that our volunteer team does to move ALS legislation and policy priorities forward. We'd love to have you join if you're interested. So I'll put that in the chat, but just a few housekeeping items. Please keep your microphones muted. Um, and this is being recorded. So we're going to be sending this out after within a week of the webinar recording. So please keep your microphones muted unless you're a presenter and speaking. We have a lot of ground to cover today, so we're going to ask for you to put questions in the chat. We do have time at the end for Q&A, but if we don't get to all the questions, we'll send out responses via email as well. So with that, I would really love to introduce some of our presenters today. We have a really star-studded team. And first, I'd like to introduce Jack Silva. Jack is one of the co-chairs of the Legislative Affairs team. He's going to help guide us through the webinar today and really talk about the ins and outs of the Act for ALS. And I'm going to share my screen. And we'll also be hearing from Danielle Carnival, who is the first CEO of IMALS and who shepherded alongside the community this act into passing Congress. So this is really incredible to be able to hear from Danielle. We also have Dan Tate on the call. Some of you probably know Dan. Dan is a board member of IMALS. He is one of the most incredible advocates for ALS advocacy. And in his day job, he does legislative advocacy. And we are very grateful to have Dan on our board and as an incredible community member. We also have Dana Little, who's here with us today. Dana is a Rockstar legislative team member. She is in Pennsylvania, but will probably tell you she's a Jersey girl. So she's going to be closing us out talking about calls to action for the community and what we can do to continue the incredible work of the Act for ALS. So with that, I'm going to share my screen and Jack, I'm going to turn it over to you.
Jack, you're muted.
If this is your first Zoom meeting and forgot to unmute yourself, press one. Um, yeah, thanks, Julie. Really excited to talk about the Act for ALS today, especially as we're coming into an important time to reauthorization. Um, Going to be discussing a few important things today. In terms of the components, go through a quick agenda. Dan and Danielle will be going through a brief history of the Act for ALS. They were here, as Julie mentioned, on the ground, mobilizing at the top and the bottom, the entire community to get the Act for ALS done and rolling. So they'll be going through the landscape, what the purpose of the Act for ALS was, and how they got the community really mobilized. And then let's go over the most important parts of the achievements of the Act for ALS: research, government funding, and what that means for data, sharing data, and how that translates into clinical trials. This was the first bill, federally funded bill, that helped EAP, that gave EAP a groundwork for allowing for research. And then finally, reauthorization 2026, what's going to happen, what's going to need to happen next for us to continue the Act for ALS. And then we'll go over some questions at the end. I want to make sure we get to everyone. So let's get into it. And Danielle, I will give it to you.
Great. I saw a question pop up in the chat on what is EAP. We will get to that in the explanation of the bill and what we were trying to solve. It is so good to be back with this community. I see many familiar names and faces, so thanks for having me back. If you go to the next slide, just want to give a little bit of overview of why this process was initiated. Mainly, there were three things that we were trying to fix, and this was from working with and listening to this community. One was that people living with ALS were not getting access to therapies. The second was that we noticed a lack of coordination and collaboration among federal agencies, but also a way to interact with companies and people living with ALS, caregivers and families, in really developing a cross kind of whole of government strategy to drive progress. It just felt like there wasn't a clear direction, and so we didn't feel like the momentum was going in the right direction. And third, ALS was terminally underfunded. And additional federal funding was needed for ALS and rare neurodegenerative research. So what were we facing in research and access challenges? Prior to the Act for ALS, there was really widely adopted exclusion criteria for clinical trials. These are the rules of you can't participate in a clinical trial if. And one of those was that anyone who had experienced symptoms for 2 years was not allowed to participate in the majority, and I think at that time, all of clinical treatment clinical trials. Now, for any of you in this community, you know how long the path to diagnosis is. And so too many people were getting locked out of having any chance at a potential therapy, access to a potential therapy. Of course, expanded access protocols, or EAP, existed, but there were limitations to being able to access EAPs that we'll talk about a little bit. So the reality was that because of the long timeline for drug development and because of lack of access for most people living with ALS to clinical trials, we were looking at a situation where generations of people were going to get diagnosed with ALS and not have access to anything, because it takes 10 to 15 years from discovery to approval for a new drug. The other part of this is that if we're excluding anyone who's had symptoms for more than 2 years, that's the majority of people living with the disease. And so we weren't getting any information on how potential therapies may impact folks in that category. And so the majority of people weren't being studied. We weren't getting more new information. And so we really wanted to address the challenges that I talked about and these. And so if you go to the next slide, this is something you all know very well. It didn't feel like the federal system and response was on the ALS clock. And so thinking about how we solve for some of these challenges in a way that meets this community in a meaningful way and on the ALS clock that all of you know too well was a priority. And so next slide. So what are EAPs? Expanded access protocols are an FDA-supported way where folks can get access to experimental therapies, so treatments that are still being tested, but they can get access to those outside of a clinical trial. This is something that has existed for decades, but there's a few challenges, especially in ALS, for getting access to these. One is that small companies were largely driving the development of new therapies to treat ALS. And so the financial challenges of sponsoring an expanded access program outside of a clinical trial was really a financial challenge for these small companies. There are individualized EAPs, so someone can work with their doctor and request access to a drug just for them. So not a big program, but just for them. But again, the bureaucratic barriers and organizational barriers to actually getting that and then being able to pay for that therapy because it's an experimental therapy was a challenge. And so we thought the expanded access protocol was the right pathway, but we had to find a way to get it funded and to get access for people who weren't going to be allowed onto clinical trials. So if you go to the next slide. This is what we were solving with the Act for ALS. And so the Act for ALS did three things. One, it made up to $100 million available each year from 2022 to 2026, so the length of the initial bill, to build pathways to fund expanded access to ALS investigational therapies. This was through an NIH, so the National Institutes of Health is the big biomedical funder, as many of you know. And so we said NIH needs to step up and fund EAP programs for ALS so that we can get more people access to therapies who are excluded from all clinical trials, and so that we can learn more about how these drugs work in more people living with ALS along the spectrum. The second thing it did was created a public-private partnership through the FDA. So again, this not feeling like the government was moving at the speed of the ALS clock, we wanted to have a very focused way that the FDA could learn from the patient and caregiver community and connect that with drug companies so that we could really have a strategy that was driven by the voices of people with lived experience with ALS. And then the third thing it did was increase research, FDA research funding, so that we had more information around how the best regulatory approach. So the FDA regulates drugs. That means they get to say which drugs are safe and effective based on clinical trials. But there's lots of things that go into how they determine the criteria of evaluating those therapies. And so the additional funding here was to accelerate research to understand how to evaluate therapies to treat ALS and other rare neurodegenerative diseases. And so I'm excited to hear from the group after Dan and I on the real impact, but one of the we knew from the beginning was driving up funding. And so the Act for ALS has provided the single largest source of federal funding for ALS research. Like I said, it was up to $100 million for each year over 5 years. So a really great feat for the community in creating this brand new, never before funded EAP as an experiment to see if we could accomplish the goals of getting access to therapies to more people in this community and learning more about the disease at the same time.
One thing to add to that, Daniel did a great job, but one thing that was really important is to have both FDA and NIH evaluating the EAPs, so they have more force to work together and on the program.
Yeah, exactly, Dan. So part of the gap was having a pathway from research to FDA approval. And this kind of baked that in by having the FDA has a step in approving expanded access protocols. And in this case, they had that step directly connected to NIH funding EAP programs. So it gave us that connection that is so important to see from experimental, from the scientific side all the way through approval. Great point, Dan. Anything else I missed? Dan is the real expert here.
No, you were phenomenal as always.
All right. Well, the next section, I'm going to lean on Dan's expertise a lot here, because getting a bill written is one thing. Actually getting it introduced and passed is the feat that so many of you contributed to, and what I know this team is going to be asking for support for reauthorization to do all over again. So if we go back to 2021, we IMALS had some success because of Dan and his team and another group called Winning Strategies Washington and Brian and Sandra's amazing leadership in getting attention and starting to move more funding and move policy through Congress. But this was a standalone bill with a big dollar amount attached to it. And so we had to really expand and build the foundation to move this through Congress. And that happened at all levels. So we had amazing strategy from the top in making sure that this was strongly bipartisan from the beginning, making sure that leaders in the right positions were engaged, had constituents calling and meeting with them, and really driving kind of how you get something moving in Congress. But the bulk of the work was done by this community. So the legislative affairs team at the time was relentless in finding and recruiting volunteers and then making sure that they had the materials they needed to make a case to their members of Congress, so both the House and the Senate. Dan, do you want to talk about any individuals or kind of how this work really, really took hold? Because the speed at which this happened is remarkable.
Sure. So, it began, we focused on building the ALS caucus and the Congress, and there were several people who were critical in the volunteer network, namely Cindy Morris and some some others who were really critical in um urging the community to get involved. I didn't know how big was I am ALS at the time.
When we started this, I think there were 4 or 5 of us.
Yeah.
And the
So,
caucus didn't exist for the most part,
and,
not in a functional way.
and so people people on the legislative coaches were critical in getting people motivated and explaining how to advocate. Now we have this all down through the leadership of the ledge coaches.
I think the other important thing, so as Dan said, creating and growing the ALS caucus was the first mission of the legislative affairs team, because that gave us a committed group of folks who publicly said they care about this cause. And so by giving them a piece of legislation that directly solves an issue for a major issue for this community, it gave us a lot of leverage to say, you're a part of this caucus. We have to have you really driving this. The second thing was getting the entire community to come along. And so a lot of work that the Legislative Affairs Council and Dan and I and Brian and Sandy and others did was meet with many other organizations to stack everyone else behind this legislation, because it couldn't be just one organization saying that this was a solution, but there were many relationships that other organizations had with members of Congress and staff, and we needed to leverage all of those. And so making sure that there was a broad consensus that this was a solution and this was something that had to move forward was a huge benefit to the effort moving forward. And that meant a lot of negotiating on the specifics, which we don't have to get into, but we landed in a place where a unified front across the ALS and even broader neurodegenerative community could say that this was something that was important. And I just saw Krista mention in the chat, it wouldn't have gotten done without her, for sure, and many, many others. Do we want to go to the next slide? Dan, do you want to talk through this, or would you prefer I start?
Um, you can start and I will add.
Okay. Well, what Dan will say from his many decades of experience is that this is not a normal timeline for getting a
No,
bill written and
it's
introduced.
extraordinary. Fast is an understatement.
But that's why I think we have so much confidence that this community can get it reauthorized on almost as aggressive of a timeline. Because so from getting introduced in a strongly bipartisan way, the community, as you can see here, really mobilized. More than 45,000 emails sent from constituents to their members of Congress through IMALS. And as I said, this was a coalition of organizations. There were many more than that, but just this community drove more than 45,000. The community pushed through some resistance. There's always another issue that's impacting someone's willingness to sign on to a piece of legislation, something that had nothing to do really with ALS was holding this up. And the community signing a petition to get a vote, almost 10,000 people calling and emailing, got this done. It could not be ignored. It was very clear publicly and to all members of Congress that a separate issue couldn't stop this because the community was going to make sure that everyone understood that that's what was happening.
So there were two things to note, and one Danielle said because it's totally correct. First off, is you or the engine that makes our work possible. Without the volunteers and all this grassroots, no one would care. Secondly, if you listen to what Lisa Murkowski and Chris Coons said on the Senate floor, the advocates made all the difference. Look, I am pretty good at legislative strategy, and I think been doing this long enough to know what works and what does not. The most important thing for any strategy is to have the horsepower of the nation behind us. And that is what happened with all of the phenomenal work of this community, not just I am ALS, but others really united to make this happen. Last thing, one of the things that Daniel mentioned was that we had to overcome barriers. So in the first instance, NIH was adamantly being opposed to um to the legislation. Now they were one of our biggest pro- proponents, but they were fighting us every step of the way.
Yeah, Dan's right. Part of the coalition building was also making sure that the agencies that were impacted by the legislation were also on board, or at least not in opposition, because members of Congress go to the leadership there and ask them what impact it will have and how they feel about it. And NIH, for a little bit, was confused about what really happens in ALS and was worried about people. Going through this program and getting expanded access and having clinical trials not filled. And so making that case that there was a difference between the population that would be available and able to participate in this program and those who are not, and those who are able to enroll in clinical trials is completely separate. And there was no risk to moving forward clinical trials because we don't want that to happen either. So there was a lot of work done. The last thing I will say before finishing the timeline here is that the community, the amount of volunteers in the community working on this is how it got done, because it was on all fronts. People went to town halls in hometowns, people sent emails, there was a robust social media movement. There was testimony. There were people directly asking their members to go to the floor and talk about this bill and air out the fact that this needed to move forward. So I would just encourage all of you who are ready to participate in the next round for reauthorization to be really creative and think about all of the different ways that you can make sure that this reauthorization is on the minds and hearts of members of Congress and their staff, and then it can't be ignored. So on December 8th, getting close to the end of the Congress, the bill was passed through the House, just a week later through the Senate, and just a week after that, signed into law by President Biden. And as a point of personal reference, I will say, to be able to work with this community, unfortunately, I had just left to go work for the Biden administration, but being able to be on that side of things, to see this community behind the president. It was still pandemic times, so it wasn't in person, but on video screens, all of the people who had put so many hours into getting this done, but visually behind the president as he signed the bill was really amazing, and I can't wait to see that again.
I was saying Daniel was totally critical the number of hours we spent on the phone at 10 or 11 o'clock in the evening is staggering.
Yeah, I miss all that time together, but I'm excited that you all are going to take this and go forward. I think that's it for us. Passing it over.
Thanks, Danielle. Thanks, Dan. I think what we got from them too is that what our community built wasn't just a bill, it was a whole new way of thinking about ALS research, access, about urgency, and really one that finally matches the reality of the disease. So let's talk about the impact right now. Um, the ALS research, ALS access isn't a theory really anymore. It's happening now, and because of that, because of the Act for ALS, people who never had access before are getting potential treatments and participating in research at the same time. So this is a fundamental shift, everyone. In ALS, we used to talk about research, we used to talk about treatment as if they were sequential, right? First you study, then someday you treat. What the Act for ALS is proving is that those two things can be the same action. When someone receives an investigational therapy through an Act for ALS expanded access program, they are receiving care, which is great, but then that experience becomes structured, usable data. So that means when we're learning in real time about safety, about progression, about response, care is still being delivered. So people living with ALS who are 2 years or more into symptoms, people that are historically excluded from clinical trials, are now generating the kind of, real world evidence regulators and payers really need. So that evidence now helps more therapies toward FDA approval. It helps insurance coverage, for everyone with ALS. At the same time, the Act for ALS is funding this coordinated research ecosystem, which means shared data, which means shared samples, which means shared platforms. So discoveries now aren't staying siloed. And that's really how progress accelerates. That's how access, that's how evidence, that's how research moves together. So if we're focusing now on the traditional versus the Act for ALS EAPs and how they're changing the system in that respect, and if we can go to the next slide, talk about that. The traditional expanded access was, yes, it was compassionate, but it was limited. It was focused on helping individual patients. It was often a last resort. It often didn't have consistency. And most importantly, too, there was no contribution to broader research process. There was no contribution to how it could actually evolve into helping more people with ALS. So historically, that traditional expanded access depended on an individual company, right? A manufacturer, a physician agreeing. So physicians would have to navigate with, they would have to carry the burden with a lot of administrative stuff. And then also patients too, at the same time, they were absorbing indirect costs, right? They were programs were fragmented, programs were small. So when you talk about that fundamental change, that's what the Act for ALS did. The expanded access, it can't, emphasize this more, under the Act for ALS is federally funded. It's coordinated. It's very, very intentional. And that funding, that federal funding is the game changer. It removes it removes that logistical burden from these small biotech companies and individual clinicians, making the expanded access scalable instead of just the exception. So now these programs are built as research protocols. They're collecting safety data, they're collecting efficacy signals, they're collecting those real world outcomes, the outcomes that we want to show the FDA across the entire full ALS population. So that important data now in turn is not sitting on sidelines. It's doing what we need it to do. It's informing the FDA in their decision-making process, giving them more confidence, strengthening the understanding of benefit risk profiles, and complementing um, the clinical trials that are already going on. So that means now that this isn't just access or research, it's access that's generating research. And that's the real breakthrough. So how does that transform the, research landscape? Next slide, please. So this is where everything connects, right? We want to take a pause, maybe digest what's going on in the screen, but I'm going to walk you through everything. Um, the first thing that's going to jump out at you is 750 people. Through the Act for ALS, 750 people with ALS have already gained potential access to investigational therapies. Um, and, when I tell members of Congress when I'm talking to them on the phone, 750 people might not be a big number to you, but it's a big number to the ALS community. It's a big number compared to 4 or 5 years ago, even 2 years ago, right? And that 750 people traditionally would never qualify for a clinical trial. But under the Act for ALS, that exclusion now doesn't mean invisibility. It means participation in a different but equally valuable form of evidence generation. So every patient now treated through the Act for ALS EAP, the Act for ALS Expanded Access Program, contributes data again that we don't get from trials. Those are later stage outcomes. Those are long-term safety. Those are real-world response patterns. So we're not just getting a slice of the pie, we're getting the full picture. We're getting more inclusive. And think about all of that evidence now when you're not just collecting data from that like very select group that keeps qualifying and qualifying for clinical trials when everyone else is left on the sideline. That evidence is feeding into a shared research infrastructure. AMP-ALS, that's ensuring the data is shared through the ALS knowledge portal, which is basically collecting a bunch of data, feeding into the FDA, or I'm sorry, feeding into the NIH. So it has visibility into the FDA, but also so other scientists, other researchers, other clinical trials can benefit from that EAP that's going on. CPATH, that's strengthening how outcomes are measured, right? That's getting regulators involved so they can actually influence the how those outcomes are measured. And then finally, all ALS, that's anchoring everything, right? That's anchoring everything into a deep natural history and biology to prevent and assess. So, and this is creating this closed loop where I like to say that access enables treatment, treatment generates evidence, and then evidence is sharpening that research, and then research improves the next opportunity for access. So access to treatment, treatment to evidence, evidence to research. That's what's creating the
Can
new opportunities.
can 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 I add one thing to your explain overview? No, um it's really important to know none of this existed before I for us. So, and everything that Jack just spent the last 10 minutes on is totally new. On only for acts for and will be lost uh, with, with the reauthorization.
Absolutely. And that's something that can't be reiterated more. None of this existed. No federally funded EAPs, no coordination. None of this was shared. No national infrastructure connecting these, people with ALS to researchers and regulators. It was so fragmented, it was very inconsistent, and that's what's the worst of all. It made it so slow. Um, so with that closed loop, with creating all of that, with doing things that we've never done before, it's breeding a lot of success. Love to talk about clean now and kind of what that looks like in practice. So before the Act for ALS, clean, CNM, AU8, it was limited. Access to the drug was limited. Small programs, few sites, no national scale, no telehealth. So the Act for ALS, even after it went through kind of some traditional EAPs, the Act for ALS access expanded it nationally. There's telehealth participation now, there's data being collected, but most importantly, and most important, for all of us on the call, 183 participants are receiving therapy. This is one of the this is one of the most, real world emphasis ALS data sets ever generated through expanded access. And because the data is being collected, and because data is important, being collected in a structure and credible way, it's helping patients, but it's helping regulators too. And when it's helping regulators, that's going to fast track, approval because evidence generated within the Act for ALS framework now is directly informing FDA guidance toward an accelerated approval pathway. So the treatment, if you think about it, is becoming discovery in real time. Uh, Dan, I don't know if you wanted to add anything to that too. Um, I know I'm putting you on the spot there, so I'll give you a moment.
Um, sorry. I um two things on this. I was one of the first people on CNN UN, and that was funded through the through the through the um company, but I had to go to Boston for the first 4 months. Now, as you can see on the right column, and people all over the country are getting the benefit of this, and and I think we have a patient in as far away as uh Alaska, um who is getting receiving the CNM that would never have happened because everything was um geographically located only around the big research institute.
Dan, did you just say Alaska? Wow. Okay. I didn't
Exactly.
I didn't even know that. Yeah, that's amazing. Um, so as we go into the future, as we go into what's next, the truth is, and that's why a lot of you are on the call today, is because none of this continues automatically. That's just the truth. The Act for ALS was authorized, but it was authorized for a limited amount of time. Unless we get Congress to act these EAP programs that we've talked about, this new reintroduced reinfrastructure, right? That we fought will stop. There's no time to slow down. There's no scaling back. It just ends. So it's hard to put into words like how, important this September 30th deadline is for the Act for ALS. Because if it expires, this federally funded, expanded access program ends, the people are going to be losing access, data stops flowing, research momentum stalls. So every delay, as we know in ALS land, has consequences. And, most importantly, it has consequences for people living with ALS right now. So if we go to the next slide, really talk about why a clean reauthorization matters. And this is another part that can't be overstated. Reauthorization, this isn't something that's new in Congress, though, for bills. Reauthorization is normal. Changes are common. What makes the Act for ALS different is the risk and the timing, right? The Act for ALS isn't just funding projects, it's creating a brand new federal infrastructure, federally funded access programs, coordinated research, all of that shared data, the direct collaboration between NIH and FDA. That only works if it's stable and if it's predictable. We're in an election year. We all know that. Any change to the Act for ALS, even well-intentioned, because they all are, can reset this bill entirely. When the bill resets entirely, it forces new committee referrals. It forces new negotiations. And what we know too, and with politics, those are political trade-offs. So when that happens, the bill isn't just delayed, it effectively becomes a brand new piece of legislation. And everything we've already built because of that is put on hold. So that's why we're advocating for that clean, straight authorization, which means we're only changing on the bill the expiration date. So it's really preserving what's working without really introducing uncertainty. And the intention there is to protect what we have going on right now, which is patient access, which is ongoing expanded access programs. It's protecting research momentum that's already producing results. So again, bill change becomes brand new bill. We don't have time for that. Talk about on the next slide the delays, risks.
One
Companies,
thing to add to
yes,
that, check is we are understand that experience is not perfect by any means, uh, but we feel like delay is the critical problem, and we we are fine with people going back in developing another more perfect bill for for ALS after we get in reauthorized, but the most important thing is to get this done now.
yep. Um, that's a critical point, right? Any improvements or updates to the program, whether, people are asking for, new expansions or changes to reporting or other tweaks, that can happen. And it could happen after the bill is securely reauthorized. So first, as we'll talk about, let's preserve what works, make sure we have, continue the stability in the program. And then we ask for those changes without risking access, funding, and continuing the momentum. So, what's the most limited resource in ALS? It's time, right? This is the disease where time is the most limited resource. So, when we talk about that, we talk about two paths to reauthorization, and we're pursuing both. We're doing whatever gets us there the fastest. Path one is a standalone reauthorization bill. That's moving through hearings, markups, votes, and presidential signature. This path is clear and direct, as you'll see on the slide here, but it takes time too and sustained attention. Path two is the original Act for ALS language attached to a must-pass legislation already moving through Congress. So these are bills leadership can't afford to delay, like spending packages, right? We're going to be running these paths in parallel because we don't know which window will open first, and we can't afford to wait for just one. At the same time, now what's going on is appropriations for the final authorized year are happening right now in parallel. So that means as we're advocating for the reauthorization, funding decisions are overlapping and they're interdependent. So appropriators during the appropriations process need confidence that the program will continue, in order to fund it. So reauthorization and funding are kind of moving together. So all of this is unfolding right now, as I mentioned earlier, in an election year, right? In an election year, calendars are shorter. In an election year, priorities are shifting quickly. And when priorities are shifting quickly and those calendars shorter, these delays could compound fast. So the process is long, and when the process is long, the margin for error is small. So that's why the clean reauthorization, we strongly feel, it isn't optional, it's essential. The Act for ALS exists because people showed up once, right? It continues only if we show up again. It's going to continue through our advocacy if we're showing up early, which is right now, often continuing the conversation and with that clear message, right? Keep Act for ALS whole, keep it moving, and don't reset the clock. How can we take action? How could we activate? Turn it over to Legislative Affairs team member Dana Little to take us into that.
Thanks, Jack. This is the time that we are talking about not reauthorizing is not an option, and you and we are the horsepower that Dan talked about earlier. So what we need you to do is this is your homework list right now. We need you to tell your member of Congress to reauthorize the Act for ALS as soon as possible. And we have an online action form or an easy button for you to do that. We need to ask you, we need you to ask your social media network to take online action. We need you to meet with your member of Congress or members of their staff to convey the importance and urgency of reauthorizing this Act for ALS and encourage your friends and family to do the same. Julie is a terrific resource for you and a way for you to sign up and help us with that. We would love for you to join the Legislative Affairs team. We are a fun group. We meet on Wednesdays at 4 o'clock Eastern. So you can jump on this afternoon. Julie's also your resource for that. IMALS is a terrific organization that does a really good job of keeping us up to date and posting on social media. So like and follow those pages on all the social media platforms, and you can do that today. And also, you can sign up to receive updates. I'm not sure who I'm going back to, Jack or Julie.
I'll close it out here. In the follow-up email that I'm going to be sending with the recording, I'm going to also include this checklist. And also included in the checklist are going to be these QR codes. So you can print these QR codes. You can put them on basically anything. And when people scan them with their phones, it'll take them to our actions. So you can, when your pizza delivery person comes, you can say, hey, would you want to support people living with ALS, and have them scan it? And just a really easy way to try and get as many people as we can to sort of really contribute as much as we can. So those will also be included in the follow-up email, along with all of the links to the actions and all of the things. So we really just are grateful for you all learning a little bit more about this incredible bill and what you can do to help keep this progress going. And Jack, I'm going to turn it over for you for questions. We have a bunch of
Yep.
stuff in the chat. Michael's been doing an excellent job. Thank you, Michael, of answering questions as they've been coming in. So I will stop sharing and see if anybody has anything they'd like to ask.
First, also, I saw Nana and Papa as a name in the Zoom. I love that. I don't know if they're still on though, but I remember seeing that earlier, and I said I got to give a shout out to Nana and Papa.
Scott, I see your hands up.
Yeah, I had asked earlier in the chat, do we have any idea how the reduction of 10 million is going to affect existing research projects that are currently being funded by the Act for ALS?
I think Dan answered. He said it's not ever been fully 100 million. 75 million is the highest in previous years. Fiscal year 26 has 90 million, so we go up by 15, which is a huge jump in this environment.
Thank you.
Thanks, Dan.
Sorry, yeah, I was on mute and just um 90 million this year up from 75 million um previous years. Again, we're doing something, the community's done something unprecedented. This is the largest federal investment in, ALS research EAP ever in a single year. That represents like real momentum toward the 500 million over 5 years. Um, so when we go back to ALS just didn't fund product projects, it's brand new federal infrastructure. That's what we need to continue to when we fight for reauthorization.
One other thing to add, and while other people think of questions, I saw some back and forth in the chat on other organizations or other parts of the community wanting to fix parts or rebalance funding. And I think I would just double down on what Dan said, which is there are kind of reasons to change language potentially. A lot has been learned over 5 years. But I think the risk that it would put to reauthorization, I think a huge emphasis that I would put to this team is to really band together with those other organizations and get them on board so that it's clear that this goes forward. This does not put federal research funding into ALS at risk. This was a net new program, so it shouldn't be a comparison between those. This organization also drove up research funding at NIH and at DoD for ALS. So it has been not only kind of a separate program that doesn't take away, this same community has also very much increased research funding. So I think that argument, or if that's something that people are putting forward, I think we should push back really hard on that to say that we don't want to lose the momentum and the infrastructure that is delivering therapies to patients right now and adding to research understanding that allows for federal FDA approval of new therapies. We can do both. This bill doesn't do all things, but in addition to the other advocacy that IMALS and the community are doing, I think it's so important to keep that push going forward.
Thanks, Danielle. Allison in the chat, my chat's glitching a little bit, so I'm sorry if I'm not seeing all the questions, but Allison asked, how does the Act for ALS support other diseases so that we can expand those from our circles who can help drive up support?
Yeah, that's a great question. Well, and I can defer to others as well. But what I would say is it's building systems that help other rare neurodegenerative diseases too. Well, first, the expanded access programs we've created are federally funded and scalable. I'd say that same model that we're creating now, which is again, to use the word unprecedented, can be applied to other rare diseases when, where people with that disease currently have almost no access to investigational therapies. The research infrastructure like AMP-ALS, CPATH, All-ALS, creating that shared data platform, tools, biomarkers, those are resources that any rare disease community can use to speed research. And then finally, too, the collaboration model with NIH, FDA, and just the general industry shows how advocacy and federal support can create real measurable progress. I think it's a blueprint for any other disease to follow. And also in the Act for ALS language, we had to go through some reiterations of the bill, so it's not a one disease bill anymore, too. So in terms of like the federal funding part, the research part, it's the intention is to apply it to other rare neurodegenerative diseases as well.
Yeah, Michael put two of the links in the chat just to add to what Jack said. The expanded access program is ALS specific because we wanted to make sure that that was solving a specific challenge for this community. But the FDA programs, both on the research on the regulatory improvements and on bringing together the community to develop strategy are for ALS and other rare neurodegenerative diseases. So there already is a broader community involved and benefiting from the legislation. And that's why the original set of organizations and community members who signed on and advocated for the bill were broader than ALS alone. And I'll just add, I run an organization focused on the undiagnosed community and rare and ultra rare. This is definitely a blueprint that we're looking at expanding and hope to follow in the footsteps. So exactly to Jack's point, it gives us, and was always intended to say, let's solve this problem now for people living with ALS and see how it works, and then be able to expand it to others.
Awesome. And in the chat, Andrea said also many of the companies who have received EAP Act for ALS NIH grants are working in other neurodegenerative diseases. So the learnings from their EAP studies are also being directly applied to other diseases like MS. And also Jennifer Robb, one of our Ledge team members, said, as a member of the Ledge Affairs team, we have fun and make noise for ALS. So join us. Thanks, Jennifer. Any other questions for our team?
Have we gotten dates yet for our lobby day in DC?
So we have our dates for our flag event. We're still working out some of the details on the advocacy piece for that, but stay tuned, Scott. And
Thank you.
it was like Mike also in the chat had a very similar thought, is an agenda for the Hill Days in May being prepared. And Andrea says every day is a Hill Day. Don't wait to have meetings with your reps. So yes, thanks, Andrea. And thanks everybody. If you think of other questions, my email is julie@imals. I really, really, really want to thank Danielle, Jack, Dana, Dan, for putting up with my incessant emails, for making this happen. I'm so grateful to you for the time and energy that you put into this, Jack, even when you are in a West Coast time zone. So I really appreciate your time and in the incredible perspective and everything you've done for our community. It is really inspiring. I hope everybody has felt like you're ready to take on this next level for reauthorization in 2026. Look out for the email that has the recording. It'll have that checklist that Dana went over. And you all got this, as Michael Lecker says. So if Michael says it, it must be true. But take care, everybody. Thanks so much and hope to see you on a Ledge team call soon. Take care.
See you later this
Thank
afternoon.
you. Thank you.